My name is Sandra Vasenda. This project was conducted during 2019 through 2020 as a capstone to complete my Master of Public Health degree through the Consortium of Eastern Ohio Master of Public Health program. The purpose of this project was to conduct two different analyses, a return on investment and a benefit cost analysis of rabies prevention efforts in the eastern part of Ohio for each year of the 5-year period 2014 through 2018. Ohio lies at the western border of the area where rabies is endemic in the eastern U.S., and it was thought that rabies prevention is focused here to prevent the disease from moving westward. Rabies is a zoonotic disease affecting all warm-blooded animals and is present in more than 150 countries and territories throughout the world. Although dog-mediated rabies has been eliminated in the U.S., rabies exists mainly in the wildlife population. Figure 1 in my poster shows the distribution of the major rabies virus variants. The green area shows raccoon rabies. The area of this particular study is circled in red. Every year, oral rabies vaccine is distributed throughout a 15-county area in northeast Ohio where rabies is present. Figure 2 shows the area in Ohio where this takes place. Rabies is an economically important zoonosis, and economic analysis can be a way to capture the true value and impact of rabies prevention programs. Results can be used in decision-making when planning prevention programs in the context of scarce resources. Aim. The aim of my study was to collect data on the cost of rabies prevention and calculate the benefits for both the 15-county area and also for the entire state of Ohio for each year of the 5-year period, 2014 through 2018. Methods. To accomplish this, I collected cost data from 3 sources: the 15 counties, the state of Ohio, and the National Rabies Management Program. I developed a questionnaire to collect the data and created a spreadsheet that was sent to all the counties. I interviewed individuals in the state of Ohio and received the data through a data request from the National Rabies Management Program. I also used government data, for example, to estimate the population for each year. I used a spreadsheet to total the costs and a formula from the literature of a similar study to calculate the benefits that rabies prevention efforts would provide. Results. The first table 1, shows the results of the benefit cost ratio analysis for the years 2014 through 2018. Benefit cost ratio ranged from 1.25 to 2.47 for the 15-county area, and it ranged from 3.86 to 7.57 for the entire state of Ohio. This increase in the BCA for the state of Ohio can be attributed to the increased number of beneficiaries in the state as opposed to the number of beneficiaries only in the 15-county area. Table 2 shows the results of the return on investment. I conducted both a simple ROI and a cumulative ROI using the data. Again, the simple ROI for each of the 5 years and the cumulative ROI was an overall figure. Simple ROI ranged from 0.25 to 1.47 for the 15-county area and 2.86 to 6.57 for the entire state of Ohio. To calculate cumulative ROI, which was an overall value, I used a template that allowed me to enter different discount values. I used 3% and 10% as examples here. At 3%, the overall ROI was calculated to be 1.81, and at 10%, 1.86, using 2014 as the base year of investment. Discussion. Based on these results, the main finding of this study was that the benefit cost analysis and discounted return on investment for each year of the study was greater than 1. indicating benefits exceeded costs. When simple return on investment is calculated for years 2017 through 2018, however, it falls below 1, indicating that costs outweigh benefits for those years. This was an interesting 5-year period to conduct this study, which I did not realize when I chose this 5-year period. The costs for each year fluctuated and greatly increased during the years 2017 and 2018 due to an increase in the costs of baiting for those years after a breach in the barrier was discovered in late 2016. However, the increased costs also represent avoided future costs. Published studies have suggested that in the absence of intervention, raccoon rabies will spread at a rate of approximately 25 miles per year. And as raccoon rabies expands into new areas westward, there will be exponential increased costs associated with increased prevention measures. Conclusions. Although this study was conducted in Ohio, rabies prevention efforts are part of an overall global management program. It's the goal to eliminate rabies, and focusing on the barriers to not only prevent the barrier from moving westward, but also push back the barrier eastward if possible is part of that goal. This study may inform agencies working on rabies prevention in Ohio and elsewhere of the economic valuation of this effort and the economic outcome of increased efforts due to a breach in the barrier, which may happen again. Thank you for taking the time to listen to my presentation.